Hello everyone. Today, we're going to explore a medication known as Abilify. As always, this information is intended to be educational. If you have any health concerns, please consult with a healthcare provider. Abilify, also known as aripiprazole, is a medication classified as an antipsychotic. It functions by altering the actions of chemicals in the brain. It's primarily used to manage symptoms of psychotic conditions like schizophrenia in adults and children who are 13 years or older. It's also used to treat bipolar I disorder in adults and children who are at least 10 years old, either alone or in combination with a mood stabilizer. Moreover, it's used alongside antidepressants to treat major depressive disorder in adults. In children who are at least 6 years old, it's used to manage symptoms of Tourette's disorder and symptoms associated with autistic disorder. There are important warnings associated with Abilify. It's not approved for use in older adults with dementia-related psychosis. Also, people with depression or mental illness may experience suicidal thoughts, especially when they first start taking the medication. If you notice any sudden changes in mood, behavior, or thoughts about suicide, it's crucial to contact your doctor immediately. Additionally, you should stop using Abilify and call your doctor at once if you have symptoms such as fever with stiff muscles and rapid heart rate, uncontrolled muscle movements, or symptoms that come on suddenly such as numbness or weakness, severe headache, and problems with vision, speech, or balance. If you're also using antidepressant medicine, do not stop using it suddenly. Before taking Abilify, there are several things you should consider. You should not take Abilify if you are allergic to aripiprazole. Also, Abilify may increase the risk of death in older adults with dementia-related psychosis. To ensure this medication is safe for you, inform your doctor if you have heart problems, a stroke, high or low blood pressure, diabetes, seizures, or low white blood cell counts. It's also important to stay alert to changes in your mood or symptoms. Your family or caregivers should also watch for sudden changes in your behavior. If you're pregnant, planning to become pregnant, or breastfeeding, make sure to discuss this with your healthcare provider. If you have phenylketonuria, PKU, you should know that the orally disintegrating tablet form of Abilify contains phenylalanine, and advise your healthcare provider. Lastly, if you have diabetes or risk factors for diabetes, such as being overweight or a family history of diabetes, your blood sugar should be tested before you start taking Abilify and periodically during your treatment. Like all medications, Abilify can cause side effects. These may include blurred vision, increased saliva or drooling, muscle stiffness, weight gain, nausea, vomiting, constipation, increased or decreased appetite, headache, dizziness, drowsiness, feeling tired, sleep problems, or cold symptoms such as stuffy nose, sneezing, sore throat. This is not a complete list, and other side effects may occur. Always consult your doctor for medical advice about side effects. Abilify can interact with other drugs, especially those that make you drowsy or slow your breathing. It's crucial to tell your doctor about all other medicines you use, including prescription, over-the-counter medicines, vitamins, and herbal products. When it comes to dosage, it's crucial to follow your doctor's instructions. Abilify can be taken with or without food. If you're taking the tablet form, swallow it whole without crushing, chewing, or breaking it. Now, if you're prescribed the liquid form of Abilify, it's important to measure your dose carefully. Use the dosing syringe that's provided, or use a medicine dose measuring device. It's not advisable to use a kitchen spoon, as it won't give you an accurate measurement. Moving on, the orally disintegrating tablet, known as Abilify disc melt, should be allowed to dissolve in your mouth without chewing. If you miss a dose, take it as soon as you remember, unless it's almost time for your next scheduled dose. In that case, skip the missed dose. Never take extra medicine to make up for a missed dose. If you suspect an overdose, seek emergency medical attention immediately or call the poison helpline. While taking Abilify, there are certain things you should avoid. Firstly, avoid getting up too fast from a sitting or lying position, as this may cause dizziness. Be careful while driving or doing anything that requires you to be alert, as Abilify can cause drowsiness and impair your reactions. Avoid drinking alcohol while on this medication, as it can lead to dangerous side effects. Lastly, Abilify may make you more sensitive to temperature extremes, particularly heat. Be cautious during exercise and in hot weather, and be sure to stay hydrated to avoid overheating. Now, let's address some frequently asked questions about Abilify. Some reports suggest that Abilify might cause gambling addiction in some people. This may result in intense urges to gamble and the inability to control these urges. In most people, but not all, this effect appears to be reversible upon dose reduction or discontinuation of the medicine. Also, it's preferable to take Abilify in the morning, especially if it keeps you awake at night. Research also suggests taking it at night may antagonize D2 dopamine receptors and disrupt 24-hour rhythms in insulin release, possibly exacerbating metabolic dysfunction. And yes, in certain people, Abilify can cause significant weight gain. Although Abilify has been found to cause less weight gain than other atypical antipsychotics, there is evidence that it can cause significant weight gain in people who are taking it for depression alongside other antidepressants. Side effects such as weight gain may be significant enough for some people to discontinue Abilify, even when it is working well to manage symptoms. Lastly, there are different forms of Abilify, such as Abilify Maintena, which differ in how they are supplied, administered, their FDA-approved uses, and their costs. There's also Abilify MySite, an oral tablet formulation embedded with an ingestible sensor that allows patients, and, if given access, doctors and caregivers, to track ingestion of the Abilify medication on a smartphone or web-based portal. That's a brief overview of Abilify. Remember, this video is meant to provide general information and is not a substitute for medical advice. Always consult with a healthcare provider for any questions or concerns. Thanks for watching.